I think as nurses, we don't give ourselves enough credit. Let me start with that. Because we are data people, right? And people don't realize that. We look at vital sign trends, right? We look and we automatically know, like, this patient's heart rate has dropped below 60 and they've been maintaining in the 110s, and that is a change in trend, and that is data. And we're able to look at those things and make a decision on how to appropriately take care of our patients. And so we do data every day. I started, at the bedside, I was looking at one patient, right? And I was analyzing the data there and what were my outcomes. If I'm navigating a vent, right, and I'm trying to titrate that vent and get that patient off that ventilator, I'm watching that data. When I got into care management, I was watching a different kind of data, right? I was watching their medical claims. I was making sure that, okay, I know as a nurse that if you're diagnosed with diabetes, what your blood sugar should run, where your A1C should be over time, how many refills of your medication you should have been taking, right? And so I can kind of discern what that patient's health status is going to be. Then from there, when I got into nurse leadership, I was just looking at a larger aggregate of data, right? So instead of looking at that individual patient, I started looking at, like, how is the nursing team performing as a whole, right? Were we meeting our metrics? Were we delivering an ROI, right? A return on investment? How are we moving the needle on the population? So I would run a report and look at, okay, this patient population that has diabetes, before our nurses started working with them, they were not getting their diabetic retinopathy screenings, right? Now that a nurse is involved, this many patients are now getting it. And so I was watching how we move the needle and how we make sure that people are getting the care that they're supposed to be getting. So that's where the data starts to come in. It's no different, right, than watching a patient figuring out, are they going to go where we need them to go, right? Or is the outcome going to be what we want it to be? And it's the same thing kind of with what I started doing as a client manager.